Welcome to Parent Circle Live. It's World Autism Day on April 2nd, and we would like to spread more awareness on autism and help people understand it better. Autism tends to affect the physical, emotional, and cognitive development of the child to varying degrees. Thus, today we have clinical psychologist, psychotherapist, and parenting consultant at ParentCircle, Dr.Meghna Singhal, with us, who will answer your queries and concerns on autism and help you become more aware. Welcome, Dr. Meghna.
Thank you, Subiksha. Thank you for having me here. I'll be more than happy to answer all the questions.
Thank you. So I think let's get moving on with the questions. So the first question states, my sister's son is autistic. He is 16 years old. Though her husband is very nice, they often keep fighting over the child. He blames her for anything wrong that the child does, even in front of relatives and friends. He criticizes my nephew and sister. My sister feels very bad but does not say anything. She also feels that her son is like this because of some mistake on her part. So she blames herself. How can I help my sister?
Okay, I think that's a very interesting question, and all my, deepest wishes are with you, dear viewer. I think your sister is facing a lot of undue criticism and a lot of flack for no fault of hers. And in fact, this appears to be one of the biggest misconceptions and myths about autism, that it is due to faulty parenting, something that the mother has done that causes autism. Whereas it's completely wrong. Autism is never ever caused by faulty parenting. Autism, in fact, is caused by a combination of genetic and environmental factors, and it never happens because of chaotic family environments or some kind of parenting styles. Right. So, what I would suggest for your sister is to do things which will help you gain more support. So, the first thing I would suggest to your sister is to surround yourself with positive and supportive people. I would encourage your sister to join a whole lot of both face to face and online parent support groups, which will give her the kind of emotional support that she needs, which will give her the kind of scientific knowledge she needs. I mean, ParentCircle itself has an excellent autism circle where a lot of readers write in with their questions and provide emotional support to each other. And having up to date knowledge about autism is in itself so empowering. I think having that is very important. Secondly, I think also finding out from where one can access professional help. It could be anything from occupational therapy to finding the right special educator. These days, there are integrated classrooms for children with autism who are sort of depending on their intellectual and language development. They're integrated with their typically developing peers. So finding out information and getting the right professional help, I think, will go a long way in reducing the kind of burden that this mother is facing. And one thing that I think parents, caregivers, the world over, of children with autism that they ignore is self-care. So I would really suggest to this mother to focus on herself. She would be surprised at the amount of energy she'll end up having if she takes even small breaks from her regular routine of caring for her child. So anything from, just reading a book, whatever works for her, having a conversation with a friend, going out and doing something for herself or engaging in a hobby, even though she feels, I just don't have the time for it, will go a long way in helping her deal with her own stress in caring, because caregiver burden is a big problem. And burnout can happen because of that. So these are the various ways in which I would recommend your sister to find support and help for herself.
Thank you so much. I hope it also helps her clear some more misconceptions that a lot of people actually harbor, right?
Absolutely.
So going on to the next question. My son is 14 years old and is autistic. He gets very irritated when my mother-in-law tries to tell him something. He yells at her for the slightest of things. If I tell him to calm down, he even starts throwing things at me. I am going through a very tough phase. Please help me. What can I do?
Okay, so it appears that this son who's 14 years old and he has autism, he feels irritated whenever there is communication happening, and communication and social interaction are, major areas of difficulty in autism. We know that already. So what needs to be done here in this case is to follow the child's lead, right? By that I mean is, if the child is communicating at a particular level. One has to start from there. So, for example, if the child is as verbal that he's able to make 2 or 3 word utterances, so one should follow the one-up rule. What is the one-up rule? That the parent or the caregiver, or for example, in this case, the mother-in-law, says one more word than what the child is saying. So this will so this will achieve a lot of things. One is you're starting at the child's level. You're not overwhelming the child. You're not overstimulating the child, and you're not talking in a way that the child does not understand.
True.
So you're starting from where the child is, but you're also doing a one-up, which means that the caregiver or the parent or whoever is communicating with the child is talking clearly using both language, that means using words as well as using gestures, and is explaining whatever the child is saying or doing, or explaining whatever I am saying or doing, using clear words and gestures, but a little more. Just a little more. And that is true for both verbal and non-verbal communication.
Okay.
So in autism, please always remember, start from where your child is, the level, and slowly go one up. Right?
Okay.
So this is the major way in which, the mother-in-law can be actually told about this. And, because with children with autism is that what they lack this kind of clear communication and social interaction. Okay, so we have to really get down to the level at which they're at. Otherwise, it will just end up confusing them. It will end up making them frustrated. It will end up making them angry, and they're not able to express themselves like a typically developing peer their age in the way any other 14-year-old, for example, is able to communicate. For example, a child with autism does not or is not able to communicate his frustration the way any other 14-year-old is able to communicate. Right? So for that is why what I'm suggesting is our own communication has to be regulated and has to be sort of tweaked to their level.
True. Thank you so much. I think one-up rule is a very nice process to connect with the child.
Yeah.
So I think we'll go to the next one. My daughter will keep spinning in circles whenever she's not occupied with something. Or she will keep staring at the fan when it is spinning.
Okay.
She's just 1.5 years old. So the mother is concerned whether the daughter is having autism or not.
Okay. So I understand, dear mother, what your concern is, and I can imagine that it can be really troubling to see these repetitive behaviors in your 1.5-year-old. They can be really confusing and concerning for a new parent. However, only on the basis of one sign or only on the basis of one symptom, we can't diagnose this as autism. So some of the early signs of autism include, for example, if there is, even by 1 year of age, the child is not doing any babbling. Even by this child is 1.5. So even by 1.5 years of age, the child has no one-word utterances. Or by 2 years of age, the child is not making one word utterances by 1.5, and at least 2 to 3 word utterances by 2 years of age. Secondly, one of the major distinguishing factors in autism is lack of eye contact, lack of social responsiveness, lack of smiling. So all of these signs in combination, there is not just one sign. The one sign that you're talking about is repetitive movements. But that in itself, you cannot say is indicative of autism. It is always a cluster of signs. And if you have still doubts, what I would recommend to this parent is kindly visit a qualified clinical psychologist and have your child evaluated. Because this is the right age for diagnosis of autism. Autism is usually diagnosed within the first 2 years of the child's life. And earlier the diagnosis, the better it is. The prognosis for the child is better, because then the child is able to utilize the benefits of early intervention. And the intervention can be tailored to the child's specific profile of in autism, it is often said that if you've met a child with autism, you've met only one child with autism. The deal with autism is that no one child with autism is same. Every child is different.
True.
And why? Because their own unique profiles of deficits and strengths is very, very unique to each child. So it is extremely important, if this parent is concerned about her child, she should, within the next 6 months, contact a professional clinical psychologist and get her child evaluated.
I think it's actually very encouraging to see that a parent is at least aware at this age.
Absolutely. And I think increased awareness is unfortunately one of the, the
drawbacks.
Yeah, I mean, it's not emphasized enough. People have a lot of misconceptions, as I was saying before. And yes, it's very encouraging that the child is perceptive, that a parent is perceptive enough to be able to notice some signs and symptoms, and is open enough to get them evaluated, because most of the times we brush them aside and say that, oh, this is fine or this is normal, but have a professional say that.
True.
That'll be better.
So we have a question online for you. How do we identify the interest and potential of a child with autism?
Interest and potential. All right. I think that's a very good question, because again, I think a parent who is sort of more sensitively attuned or in touch or in cue with her child or his child would only be able to ask such a question. So I applaud the parent for displaying that kind of sensitivity. Now, as far as interests go, the one thing that we recommend to parents is try out a lot of activities, because only if you try out a whole range of games, play activities, will you be able to figure out what your child enjoys. Do not make assumptions about, this for my child, for example, my child is 4 years of age, other 4-year-olds enjoy this, so my child will also enjoy this. In autism, it is not a good idea to be able to do that, because as I mentioned before, every child is unique. So start with trying out and exploring a whole lot of games, activities, and even household chores for that matter, that you can involve your child in, again starting from the level that your child is at and then going one up, to figure out exactly what works with the child. Also, it's true that what works with one child with autism may not work with another child with autism. So it's up to each parent to figure this out themselves for their child.
Thank you so much, Meghna. We'll have the next question.
Sure.
My daughter is 3.5 years old and has been diagnosed with Autism Spectrum Disorder. She has this odd habit of moving forward and backward whenever she's not occupied with something. When we ask her to stop, she gives a blank stare and continues with her movement. I find it very difficult to stop her. Please tell me what I can do. How will I stop her from repeating this movement?
Okay, so in this case, the parent is obviously, I can imagine it can be overwhelming dealing with the repetitive movements of your child, but this is actually one of the hallmarks of autism. These repetitive movements and sometimes repetitive speech, which is called echolalia, is quite common in autism, and it is called stimming. The technical word for that is stimming, and a whole lot of stimming could be, for example, flapping hands, twirling, rocking back and forth, as in this case, or as I said, it could, or even seeing objects like a fan or a spinning top which are repeatedly moving, and it gives it's sort of. So there could be a number of reasons why the child is engaging in the repetitive movements. Okay, so one of the reasons could be the child is anxious. Right? The child is anxious because, as we know, in children with autism, they find any kind of change in routine very overwhelming. Or they find any kind of unpredictability in their routine very overwhelming. They're not able to deal with that. So they do this action, this repetitive movement, in order to be able to calm themselves down. Okay. Another reason for stimming could be the child simply enjoys it.
Okay.
Yeah, it just produces this kind of sensation in the child's body, some kind of sensory feeling that the child enjoys. That could be another reason. Another reason for stimming could be that the child is just very overstimulated. So for example, some children with autism find it very difficult when they are in a crowded marketplace, because the sensory overload is just way too much. Some children find they are very sensitive to sounds. Some children are very sensitive to smells. Some children are very sensitive to unfamiliar places. So the what you can do about it stems from what is the reason for the actual repetitive movement. Usually a professional will be able to help you with that, but I can give you a couple of quick suggestions to be able to help you figure out what to do. So for example, if your child is overstimulated, so what you need to do is you need to cut down or bring down the level of stimulation. So for example, if your child is overstimulated because of being in an unfamiliar place, what you can do is try to bring your child to a familiar place. If that's not always possible, try to always carry your child's favorite blanket or toy, so that it sort of holds them. They can hold it, and they can calm down. Some children with autism can also use noise cancelling headphones, because to bring down the sensory overload, the auditory sensory overload. So that is the bit about overstimulation when they're overstimulated. when the stimming happens because of, say, a change in schedule, when the child gets anxious because their routine has been changed. So there are a couple of ways of dealing with that. The first is what we call as visual schedule.
Okay.
It's actually a picture timetable.
Okay.
Yeah. So we actually use this with typically developing children as well, who find transitioning from one activity to another particularly difficult. What we do is we take a chart paper and we cut out attractive pictures from a magazine of children doing particular activities. So, for example, waking up in the morning along with the time, then brushing, then changing your dress, then being driven to school or catching a school bus. So like that, we have a picture timetable of the child's daily activities.
Okay.
So, or we can have this in the form of a checklist that the child ticks every time an activity is completed. It brings about this kind of predictability to the routine. The child feels good that, okay, it makes the transitioning from one activity to another easier. All right. So that is one thing that you can use, a visual schedule or a picture timetable if your child is getting very anxious because of a change in from one activity to another. Now, if the child is enjoying that particular repetitive movement, what we have seen, what helps children in our clinic is incorporating that movement in their games.
True.
Right. So making it functional, basically. So in children with autism, functional play and imaginative play is very poor. It's almost non-existent. So what I mean by that is that when, say, for example, the child is moving back and forth, can we incorporate that in a game of skipping rope?
Okay.
Or can we line 2-3, say, buckets or 2-3 toys, and the child is asked to jump back and forth between them? So what that does is that by making something which is happening repetitively, by converting that into a deliberate movement, we are bringing about self-control in the body. We're also helping the child, regulate his movement or her movement and bring some kind of deliberation to the movement rather than it happening just automatically. Right? So all these, so the reason that because of which stimming is, or the repetitive movement is happening, will determine what action you take, what strategy you follow.
Thank you so much. We'll go on to the next question. My 8-year-old daughter has autism. When she's happy, she starts nodding her head strongly and claps her hands continuously. But when asked to say something about why she is happy, she becomes perplexed and it makes her very angry.
Yeah.
I do not know how to handle it. Sometimes even I get irritated when she doesn't respond the way I expect her to. But then I understand that she's different from other children. Please help.
Okay, so I understand, dear parent, how difficult it must be for you, how confusing it must be for you. But honestly, expecting your child to respond the way you would like her to respond is like setting yourself up for failure. So, and we all already know that social disconnection is a striking feature of autism. We know that children with autism, they appear unable to interpret the social cues, the social world around them, and there are so many unspoken social communication is so difficult if you think about it. So this is actually known as mind blindness. Mind blindness basically means that a child with autism is he or she lacks the ability to be able to take another person's perspective and to be able to respond accordingly. Okay, and this makes communication very difficult. This makes any kind of social interaction very difficult, because for them to be able to interpret the social and emotional gestures, cues, the unspoken and the spoken things also, it becomes very difficult. So what I would suggest in this case is a couple of things. So this parent mentioned that the child claps her hands, and so, and they don't really know what to do about that. So as I was mentioning beforehand, the first suggestion I would make is actually imitate your child. Start with imitating basically means mimicking your child. Mimicking your child and her play behavior will encourage her to also vocalize more and interact with you more. It will encourage turn taking. It will encourage her to imitate in turn what you are also doing. So suppose, for example, if your child is clapping, copy that and say that with a happy, positive tone. I'm happy. Because if you do that repeatedly, the child will associate the clapping hands with the emotion, which is what we want to really teach the child with autism, right? I mean, because they lack that kind of emotional vocabulary. So one is, of course, imitating the child. The second recommendation I would make is play with your child. Encourage play. What that does is it it also encourages language. So suppose your child is, again, in this also you can use the one-up rule. So suppose your child is putting blocks together. Okay, in very simple language, vocalize what the child is doing. Say to the child, you put the red block or just red block. You stacked it up with the blue block, or just say blue block on top. What these very simple things do is they are, you're not just showing to the child that you're present during the child's play, but you're also sort of being close to the child's eye level. You're at the level of the child when the child is, doing this, and you are vocalizing through your interaction. You're teaching the child this is what you're doing, right? So it's a very powerful way of social interaction, of reinforcing that kind of social interaction with the child, right? So imitating the child itself using the one-up rule, and also encouraging play are some of the few ways in which you definitely can fine-tune your entire behavior to match the level of your child, and also encourage this kind of the nascent mind blindness that you can encourage in your child.
Thank you so much. I think these are small tips, but they can be incorporated like on a regular basis.
Yeah.
We have one question online for you. Ma'am, my neighbor has a 6-year-old who is very uncomfortable to interact with others. She is very comfortable in her space and loves doing her own things. Is this okay?
So the child is 6-year-old, and the question is if it's okay if she's comfortable in her space. My first response to that is, dear parent, of course it is completely okay if the child is comfortable in her own space. So a lot of times, I think especially in Indian cultural context, we feel that we're not that accepting of all the kinds of temperaments and all the kinds of personality and temperamental styles of children. So a child should be outgoing. A child should be able to interact with a lot of people. A child, when guests come over, the child should be able to greet and serve the guests water. I mean, these are kind of age-appropriate expectations, but when in making these expectations and having these expectations, we sort of ignore the child's unique temperamental profile. And what I mean by temperament is, when we talk about children, we don't talk about personality.
True.
Because personality only sort of starts consolidating from the age of 18 and up.
True.
Right? So before that, we really talk about the child's inborn kind of a predisposition in terms of the child's temperament. And it's okay if the child is introverted. It's okay if the child has her own comfort zone within the house. It's okay if she doesn't prefer to go out too much. It's fine.
True.
It's fine.
True.
I mean, it's so here I would say the parents need to walk a fine line between also providing opportunities, for the child to be able to engage in social interactions out of her comfort zone, but also not pushing too hard. So it's a fine balance for the parents to walk in. But overall, I would not push my child too much, for the fear of sort of making her averse to something, that she doesn't really want to do. Right? And I think it's unfair to the child also.
True, very true. Yeah.
Right?
And we shouldn't be making conclusions.
Yeah, we should definitely not be drawing conclusions that just because she doesn't do this, that means she will never do this in her whole life.
True.
I mean, till 18, the child can, be anything,
exactly.
and whoever she wants to be, and that's fine. I mean,
Right.
she's exploring. I mean, teenage especially is the time when children adolescents typically explore different identities.
Exactly.
They experiment with different identities, and until they figure out this is who I am and this is what I would like to be. And that process goes on into your early 20s, and that's perfectly all right. In fact, that's good. That's something to be encouraged.
Yeah. So we'll go to the next question. My second son has autism, and what really bothers me is people staring at him or giving him stern looks when I take him out somewhere. He tends to shout and say hi to people randomly. I find his actions friendly, but his hellos are never reciprocated, but rather it gets him stares. This really bothers me. I don't want to feel sorry for him or me, but them staring at him makes me feel really bad. And he is very clueless as to why he gets these stares. So how can we help this mother out?
Right. So I think, dear mother, I completely understand how bad you must be feeling upon getting those stares, and how undesirable and unpleasant it can be for you to see your son being stared at, perhaps even harshly evaluated by strangers who have no clue about, his condition and what's happening. So honestly speaking, I would tell this mother, please just ignore the stares. Please ignore the evaluations of these people, because it just doesn't matter. It doesn't matter what others are thinking, because, imagine that even if you did not have a child with autism, people would find something else to think, to judge you about. People would find something else to stare at you for. I mean, people are always looking at things for, to pounce on you for. I mean, I would tell this, mother with all my empathy, is that please ignore this, because I know it's difficult, but develop a thick skin for all this undue attention, negative attention. And because it will not help you. It will not help your son. It will not help you. But what you can do for yourself and for your son is, as I was mentioning in the before, that try to find support. I mean, you're looking at people who are staring at you, but what about people, say, other parents of children with autism, in your child's school, perhaps, or, in parent support groups? There are a lot of people. You'll be surprised in your city. There'll be so many people who have children with autism. Connect with them. Find support. Read about autism. Find on ParentCircle, for example, you have, articles which are vetted by clinical psychologists and professionals. So update yourself, find scientific knowledge, find sources of avenues of activities that you can engage your child in, and focus on that rather than focusing on the things that you cannot control, right? This is something out of your control. You can't go to every person and say that, please don't do this. My child had autism. How much do you think people will understand? So my sincere request to you, dear mother, I know it's difficult, but please, I mean, the best thing you can do in this scenario is just ignore. And because it's not going to get you anywhere or your son anywhere, it's not likely to help you. Instead, focus on things that are in your control. Focus on things that you can do for yourself and for your son.
Thank you, Meghna. Thank you so much. We'll move on to our last question. Whether an autistic child can be diagnosed when it is in the mother's womb.
Okay, I understand, dear parent, where this question is coming from. So I'm sure that what you're trying to hint at is that, there is certain genetic tests that are done when the mother is pregnant, and if autism can be, one can figure out when the child is in the womb. But the answer to that question is no, because while the technology has progressed so much that you will be able to figure out if there is any genetic abnormality in the fetus. However, which exactly genetic or abnormality is very difficult to figure out. And for autism, we don't have such a specific test. So the answer to that question is no. But yes, during pregnancy, the mother, of course, has to be very careful, because there are a few factors that happen during pregnancy which actually can cause autism. So one of those biggest factors is if the mother has, rubella or German measles.
Yes.
That is one of that has been linked to autism. I mean, it's not 100% causal, but it has been linked to autism. Another very big factor is advanced maternal age. Yeah. Yes. And the third factor, which you need to be very careful about during pregnancy, is exposure to environmental toxins. Right? So these are the three factors, which are environmental factors, which are sort of related to autism. But I mean, to figure out, it's very difficult, and it's in fact it's impossible, because then there's no test that has been developed.
Thank you so much, Dr. Meghna, and it was a pleasure to have you. And I think we are somewhere inching closer to becoming more aware about autism. And this is just our endeavor to make you a little more aware. So thank you for joining us.
Thank you.
Thank you.